We really wanted to get to the bottom of that, as did many people in the sort of neonatal community around the world.
An international study co-led by researchers at the University of Manitoba have found that lockdowns during the pandemic might have prevented tens of thousands of premature births around the world.
We did find a reduction. We're pretty confident in it because we used such rigorous methodology and included so much data from around the world. And the next question is why?
Dr. Megan Azad, research scientist at the Children's Hospital Research Institute of Manitoba, says over 52 million births from 26 countries between January of 2015 and July 2020 were used in this research, which represents one of the first large-scale analysis of birth outcomes during the early months of the pandemic. Their findings showed a reduction of 3 to 4% in global premature births.
When you think on a global scale, that equates to potentially 50,000 births in those first few months of the pandemic that were diverted from being born prematurely, which is huge.
This research has opened up the question as to why so many more babies made it to their full term during lockdowns. The researchers believe it comes down to a reduction of inflammation, which can trigger premature childbirth. Study contributor Dr. David Bergner says more focus on hygiene led to fewer non-COVID infections, and a reduction in commuter traffic could have also played a role.
There was obviously a very dramatic fall off in air pollution during lockdown, but also individual level factors such as perhaps less stress in some mothers. So there are a number of avenues that are really ripe now for exploration.
Neonatal specialist Dr. Michael Narvey says premature babies are at a higher risk of death during their birth and have increased risk of lifelong ailments, and any research that can reduce premature birth is paramount.
Between 8 to 10% of babies are born preterm. If you could reduce that by 1 or 2%, the impact on our healthcare system in terms of resource utilization, but even more so from the parent's perspective of not interrupting that normal process of having that term baby that goes home with you, is profound.
Dr. Azad says it's too early to make recommendations to expectant mothers on how to avoid premature births, but says this study has put them in a position to explore that research. In Winnipeg, Mike Albanese, City News.